So today's video I'm going to talk about burrs, polishing burrs, burrs to take out decay, burrs to cut through the tooth first of all. So I'll talk to you about this Fisher burr. This is a diamond cut burr and it's called a Fisher burr. You can see it's small, it's short. The dentist uses this on a fast speed handpiece and this is how we'd get into the tooth at the very first instant. The thing to watch if you're a dental nurse, these burrs do get sterilised and used again. Some practices have single use and they'd put them in the sharps bin straight after use. Have a look at the diamonds on there. It's diamond cut. When the burrs start losing the diamonds, it's not going to cut the tooth anymore, so these do need to go in the sharps bin. So just take a look out for the ones in the burr box what look a bit drab. You don't have to ask the dentist, you can go ahead if you know that they look really blunt, just throw them away. So the next one I've got them is a packet here. These are called steel burrs. Okay, so the steel burrs, there's hundreds of steel burrs, but if you look at this one, this is called a rose head burr because it looks like a rose head. And the outside of it, it's got ridges. So when the dentist is finished with the Fisher burr, opening the tooth up, if there's soft decay which has gone down to the dentine, he will use the slow speed handpiece and he will use a rose burr. No water is needed with this. Like with the Fisher one, it's water jets on the handpiece. This will just get out. It's called a slow piece. It feels quite rattly and it rattles around getting all the decay out of the tooth. The thing to know, being a dental nurse, again, once we're finished with these do go in a burr pot for sterilisation, then they'll go through to the autoclave. When they do go into the decon room, these will get soaked in enzymatic cleaner to break down any proteins, get rid of all the blood, all the decay. These do need brushing. If you don't brush them, it's going to go into the autoclave with decay in these little grooves. It's going to come out with decay. That's a form of cross-infection. So underneath the water in the decon room, you would put them down and use a brush, just a toothbrush like this, to clean the rose head burr. You can visually inspect to make sure it's got no decay left in there, no dry blood. If that's fine, it'd go in a rinse sink and that goes into the autoclave. That's the two main burrs used in dentistry. I just want to talk to you about some polishing burrs as well. So as you can see, I've got 3 different kits here. When the dentist is finished with a restoration, if it's an anterior restoration, a composite, he will need to polish it. It's quite jagged, it feels unsmooth, so the dentist puts this on the slow speed. You know it's a slow speed because it always has this notch. Again, in my next video, I'm going to demonstrate how you connect this to a slow speed. But he uses these. He can put some prophy paste in there to polish the tooth. And he's got different ones for polishing different angles of the tooth. For example, this one is quite flat. So he'd be brushing this down on the tooth. It would be moving quite fastly, moving around in circles to go underneath the tooth and on the top of the tooth. So the last thing I'm going to show you now is these. These are called soft flex discs. They're soft and they flex. So again, we know it's for a slow speed because the way the end is. Can you see the top? It's got 4 crosses on there. So there's a selection. It says on here, you've got coarse, you've got medium, you've got fine, and you've got extra fine. So on the first instance, the composite fill-in, he will be putting the soft flex disc. So one side is rough, the other side is smooth. So if he's doing underneath an anterior tooth, you need to push it down this way. It's really important the way you put it down. He doesn't want to be on the tooth this way because it's not going to do anything because that's the smooth end. So if you needed it that way, you'd have to turn it around. Depends what area of the tooth he's doing. You can turn it around this way for doing underneath the teeth. So once you'd have used the coarse one, you'd then go on, use the finishing one. So you use the different polish ones. The restoration, you will just use the ultra smooth. Okay, so that's it on polishing burrs.